I'd like to talk a little bit about what to expect whilst you're going through your treatment. There are various stages along the way, and these will vary from person to person. It's very important to bear in mind that your diagnosis is particular to you, and so too is your treatment plan. It's subject to change as you progress through it. We may find that something will work better than what we initially proposed, or that you're not responding in quite the way we anticipated originally. So throughout your treatment, there will be regular reviews, and we'll look at all the options as we go along. An important point to mention here, you'll see that we're mentioning palliative care. A misconception is that palliative care means you are at end of life. That does have its place in palliative care, but for the most part at this stage, palliative care is more about addressing symptoms so that we can move on with your treatment. First and foremost, we want to remove or cure the cancer if this is possible. Other options are to slow down or stabilise the growth of the cancer, relieve symptoms. This one's really important, and we need you to keep talking to us about your symptoms. Sometimes we'll do one treatment first to make another treatment possible or more effective. Obviously, we do strive to reduce the risk of cancer coming back, and throughout all of this we need to monitor the cancer. It is possible that you might be able to participate in clinical trials. We don't actually operate many of these here at the hospital, but if you think that you might be interested in participating, do speak to your team and see if they know of any appropriate ones. We have to mention as well that the option of no treatment is also a treatment option. It's our job to put forward a list of treatment proposals, but if you choose not to have treatment at all, that is entirely down to you. If you want to go that route, we will still support you. Don't think for one moment that we will stand back and not give you any support. And again, just to reiterate, it's really important to remember that your treatment plan is specific to you. If you come across somebody else with a similar diagnosis, their treatment may be different to yours. When people hear about a cancer diagnosis, the first treatment that springs to mind is chemotherapy. Indeed, this tends to be the most popular option still, but it's important to bear in mind that it has come a long way over the last 20 years or so. For the most part, chemotherapy is administered here in our day unit, Fortune's Well Day Unit. When you have chemotherapy, it's normally done by inserting a needle, a cannula, into a vein in your arm, and it's administered what we call intravenously, IV. You'll find you're hooked up to a drip, and you'll be given a comfortable seat in the chemotherapy unit. You may well be there for the best part of the day. You'll be monitored very carefully throughout the treatment to make sure that you don't have any reactions, and there will always be nurses on hand if you have any concerns or questions. Immunotherapy is quite similar to chemotherapy, and it's more of the newcomer, and you're going to see advances in immunotherapy over the next few years. It's often administered in the same way as chemotherapy, so via an IV drip in your arm, and again it can take several hours to have your treatment. Broadly speaking, the difference between chemotherapy and immunotherapy is that chemotherapy seeks to destroy all the cells in the body, including the cancer cells, and then when the body rebuilds itself, hopefully it will be without the cancer cells. Immunotherapy, on the other hand, puts your body's immune system into overdrive so that your body is actually attacking the cancer cells. For both immunotherapy and chemotherapy, sometimes they're administered in tablet form or possibly even injection form, and that means that you don't need to stay in hospital all day or for several hours at a time. Radiotherapy is another option. You may well be aware that we now have our own radiotherapy unit here at DCH. Unfortunately, not everyone can have their treatment there at the moment, but the list of people that we're able to treat is growing all the time. Broadly speaking, for radiotherapy, there are two different types. There's palliative radiotherapy, and then there's a course of radiotherapy. Palliative radiotherapy is administered normally just as a one-off, and it's to help with pain relief. If you're having a course of radiotherapy, that will probably be done at our pool unit. You may well find that you need to attend every day, Monday to Friday, for up to 6 weeks. So although the treatment itself only lasts for about 10 minutes at a time, there is that daily commitment to attend. Surgery is also used, and sometimes that may be in conjunction with the other treatments I've mentioned. It could well be that surgery is used to remove your tumour, but that may happen after chemotherapy has been used to reduce the size of it. Last but not least, we have what we call watch and wait, or active monitoring. This is what happens when you're told that you have a cancer diagnosis, but at the moment that cancer is not sufficiently advanced to need treatment. We are aware that that's a bit of a worrying time for you because we've told you your diagnosis and then we're saying we're not going to do anything. However, what you need to bear in mind is that your cancer is low grade at this time and you will not get any benefit from treatment. If that's the case, we'll monitor you, possibly with scans and blood tests on a regular basis until such time as treatment becomes needed. You may also hear about targeted or hormone therapies. These are mostly used to treat prostate and breast cancers and are often administered either by injection or tablet format. With all of these treatments, there is the risk of side effects. Bear in mind that these days we can do an awful lot to help manage side effects, so the picture from days gone by of somebody looking absolutely awful on chemotherapy is less common these days. The side effects that you're probably most aware of are things like hair loss, weight loss, diarrhea, nausea, and fatigue. Nausea is something that we can do a lot to manage. You'll probably routinely be prescribed some antiemetics. So these are anti-sickness tablets which you take alongside your treatments, and these can be very effective. If you find the one you're given isn't working, please do contact your CNS because there are others that we can try. Hair loss is another possible side effect. It's not as common as it used to be, but it can still affect some people. If you do suffer from this, you can choose whether you want to go the route of having a wig or a bandana, or if you just want to tough it out. But whatever you do, we have various different ways of supporting you through that, including a national charity which provides goodie bags. Fatigue is something that we will come on to in more detail later on. We just want to make you aware of it. Not everybody succumbs to it, but it's important to be able to identify the symptoms of it and to know what to do if you do fall victim to it. Whilst you're going through your treatment, we will need you to have regular blood tests. To make this a bit easier, we have a phlebotomy clinic that's held in the Robert White unit. You do need to pre-book appointments for this, and you can either phone in directly to the Robert White reception to do this, or if you talk to one of us, we can make those appointments for you.